Rogelie, your student nurse from Notre Dame of Tacorong College. From now, I'm going to do the Glasgow Coma Scale. The Glasgow Coma Scale is the summation of the score of eye, verbal, and motor responses. The score is determined by the sum of the score in each the three categories with a 3 maximum score of 15, which indicates fully awake patient, and a minimum score of 3, which indicates deep coma or brain dead state. Purpose. The Glasgow Coma Scale is used to describe the general level of consciousness in patients with traumatic brain injury and to define broad categories of head injury. Procedures and rationale. Perform hand hygiene. Before we start, we need to use alcohol to reduce microorganisms. Next, initially observe if the patient is opening their eyes spontaneously to evaluate patient wakefulness and awareness of the environment. Next, if the patient is opening their eyes spontaneously, your assessment is complete, score 4 points. You will then move on to the assisting verbal response. 4. If the patient is not opening their eyes spontaneously, you need to work through following step until a response is obtained. You need to speak to the patient. Hello, Ma'am Kayla. How are you? So number 5, the procedure. If the patient eyes opening in response to the sounds of your voice, score 3 points. You will then move on of the assessment verbal response. If the patient doesn't open their eyes in response to sound, you need to move your assisting eye opening to pain. Example, applying pressure on the nail beds of the finger for 10 seconds. Hello, Ma'am Carla. How are you? If the patient eyes open in response to pressure on the nail belt of the finger, score 2 points. If the patient does not open their eyes to a painful stimulus, score 1 point. You will then move on the assisting verbal response. Hello, ma'am. Hello, Ma'am Kayla. If the patient cannot open their eyes for some reason, you shall document that eye response could not be assessed. You will then move on the assessing verbal response. Next, assess verbal response, a maximum possible score of 5 points. So let's proceed to number 10. Initially, try to engage the patient and the conversation and assist if they are oriented. Some common questions you can ask the help assess that might include. Ma'am, can I tell your name, ma'am?
I am Kailin Kabakang.
Do you know where you are at the moment?
I am in hospital.
Do you know what the date is today?
February 5, 2022.
Thank you. If the patient is able to answer question appropriately, the assessment of verbal response is complete, score 5 points. Then move on the assisting motor response. Can you tell your name, ma'am?
I am Anika.
Do you know where you are at the moment?
In my house.
Do you know what the date is today?
December 25.
Okay, ma'am, thank you. If the patient is able, response don't seem quite right. This will be class confused conversation, score 4 points. Then move on the assisting motor response. If the patient responds with the seemingly random words that completely unrelated to the question you asked, this will be classed inappropriate word, score 3 points. Then move on the assisting motor of response. So let's proceed the number 14. If the patient is making sounds rather than speaking words, then the will be classified incompressible sounds, score 2 points. You will then move the assisting motor response. Next, let's repeat the question. Ma'am, can I tell your name, ma'am?
Hot dog.
Do you know where the moment?
Burger.
Do you know what date is today, ma'am?
Spaghetti.
Okay, ma'am. If the patient is unprepared or the treatment or has other factors interfering with their ability to communicate verbally, the response cannot be tested, or for this you will write NT or not testable. You will then move assessing motor response. Next is assessing motor response, a maximum possible score of 6 points. 17. Ask the patient to perform a two-part request. Lift your right arm off the bed and make a first. The patient able to follow this command correctly score 6 points, and the assessment will be over. To evaluate patient ability to obey a command, localize, withdraw, assume, abnormal body position is response a painful stimulus. Ma'am, can you please up your arm, ma'am? Okay, ma'am. Thank you. Next, the procedure. If the patient does not obey the command, apply painful stimuli. If the patient make attempts to reach toward the site at which you are applying a painful stimulus and bring their hand above the clavicle, this will be classified as locating to pain, score 5 points, and the assessment will be over. Let's proceed to the 19. If you are applied painful stimuli and patient tries to withdraw from the pain, patient tries to pull their arm away from you when applying a painful stimulus to their fingertip. Score 4 points and assessment will be over. Let's proceed. If you are applied a painful stimuli and the patient responds with an abnormal friction, score 3 points, and the assessment will be over. Next procedure. If you applied a painful stimuli and the patient responds with an abnormal extension, score 2 points, and the assessment will be over. If you applied a painful stimulus and the patient has no response, score 1 point, and the assessment will be over. Next procedure, if the patient is unable to provide a motor response, paralyzed, this shall be documented as not testable. And then next, the second lastly, once you have assessed an eye-opening verbal response and motor response, you add the score together, calculate the patient GCS documentation, contribute to continued data collection necessary for the client. Okay? And lastly, the GCS shall be documented showing the score for each care plan individual behavior tasted.